Hello and welcome everyone to this special podcast panel by International Stuttering Association in celebration of International Stuttering uh, Awareness Day, ISAD, observed every year on the 22nd of October. This year's theme is close to my heart: stuttering and mental health. While stuttering is often seen as a speech disorder, its emotional and psychological impacts run far deeper. Today, we are bringing together four inspiring voices from around the world who have been living, supporting, and advocating in this space, not just professionally, but personally too. We will explore how stuttering affects mental well being, how therapy and support can change lives, and what we can do to build a more inclusive and understanding world. Each panelist will respond to three thought provoking questions, followed by a brief closing message from everyone. I hope this conversation sparks empathy, reflection, and inspiration. So, let me start by introducing our wonderful panelists today. Number one is Douglas Scott. He is joining us from USA. He is currently the chair of International Stuttering uh, Association, a long-time uh, advocate in the stuttering support community. Doug has served as a chapter leader, convention coordinator, and ambassador with the National Stuttering Association, and is currently on the ISAD board. He brings decades of lived experience and peer support leadership. Welcome, Doug.
Thank you, Ahmad. I am glad to be here.
Thank you. Yes. And our second uh, panelist is joining us from UK is Olga Oryema, who works with the National Health Services and is a trustee at STAMMA UK. She brings a valuable perspective both as a professional and an advocate, especially in the area of youth empowerment and representation. Welcome, Olga.
Thank you for having me.
You're welcome. And next, we have our esteemed a panelist from Pakistan. We welcome Miss Aruba Ayub, a clinical psychologist who works with children and adults. She's part of Say Health Fluency Craft program, providing psychotherapy support to adults who stammer, focusing on emotional healing, anxiety, and self-esteem. Welcome,
Hello,
Aruba.
everyone. Hello,
Yes,
Sir Ahmed. How are you?
I am fine. Thank you. And last is from South Africa. Uh, we have not at the moment, but she will join us shortly. It's Dina Lillian, a qualified speech therapist and uh, audiologist with master's degree who leads Speak Easy, a self-help group for people who stutter. She is also the South African representative for ISA, IFA, and ICA, a passionate voice in both therapy and advocacy. So, to start with the question, I thank you all for joining here today. And to start with the questions, my, my first question is to you, Doug. Like, how did your stutter affect your emotional health and self uh, image while growing up?
It affected my emotional and self-image a whole lot. Actually, when I'm answering this particular question, I'm sort of going back to my childhood, and it still causes me a bit of stress and anxiety. Stuttering affected everything about me at an early age. Okay, from the amount of speaking that I did, from the how I interacted. One of the saving graces, though, was that stuttering was very prominent in my family. So my family was aware of stuttering at an early age. My grandmother stuttered. I had an uncle on my maternal side who stuttered. He had a kid that stuttered. So it was very, very common. So I was not treated in a bad way at all. I had, it was support, but it was a support in a silent way. And basically, I was treated as normal. So I was not given any special consideration because I stuttered. That was a good thing, and it was a bad thing also at the same time. Overall, though, it was a positive because I was treated normal, basically. It would take a long time for me to go into all of the ways that it affected me. The thing, though, that I want to stress is that I was able to counteract that with a parent, namely my mother, who balanced the emotional turmoil and hardship of stuttering that had on me at that particular age. This was before I had any speech therapy. This was before I joined the NSA, where I was able to progress at a rapid rate along my stuttering journey. She instilled in me a sense of quality. What I mean by that, she kept reinforcing and kept telling me, you can do anything. You can be anybody. You are worthy. Whatever you do, you can do not let stuttering hold you back. I was not able to use that as an excuse to avoid certain things. That was a challenge in the early days when my stutter was extremely severe. Okay. My stutter is a solid block. So I would open my mouth and there would be no words coming out. So that made it very, very hard. Fortunately, my personality was always an outgoing person. So I didn't have some of the other challenges that some of other people who stutter have. I wasn't shy, didn't have high anxiety about speaking. I did have high anxiety about stuttering because I never knew if I was going to stutter or not and how severe it was going to be. And in those days, when I did stutter with the silent blocks, it took a lot out of me. So in a very long story short, stuttering basically reduced or stopped me from participating in a lot of things that were verbal and oral. And I did that myself. I held back because I didn't want to show my stuttering in public. So that was the mental toll that it took on me.
Thank you, Doug, for sharing. It's quite relatable for me and um, uh, inspiring too. Being a stammerer, it's really hard to deal with the mental health issues and especially to share them with others. Thank you so much. And now my next question to Olga. How has stuttering shaped your mental health journey within a within a professional environment like NHS?
So, so for me, a lot of my worries, especially when starting to work was my stammer, and that did have an impact on my mental health in relation to work and in relation to growing up and progressing through my career. So when it got to a point where I felt stagnant in my career, which was quite early on, I did go and seek help through speech and language therapy, as stammering as a child is completely different to stammering as an adult. There are things that are still similar, but the challenges, what one of them being the world of of uh, of work, is something that a lot of people don't con- consider, especially when it comes to the impact of stammering on your mental health. But so far, especially where I work, my workplace has been extremely supportive with my stammer and have given me reasonable adjustments, so things that can make work easier for me, because I stammer, and I also have a really supportive line manager who understands my stammer, which has made work a lot easier to go to, and has lessened my mental health difficulties in relation to my work. I still struggle. It's still an ongoing journey when when I consider my mental health in relation to my work and my stammer. But I know that I am supportive, and I know, for example, the rights that I have. So over time, when I think about my mental health at work, it has gotten better.
Thank you, Olga. Like being at the workplace and to deal with the mental health is very difficult. I remember my first job interview. I stammered so severely that the person who was taking the interview, the journal manager of the company, was not able to understand a single word what I was saying. But still, uh, he uh, asked me that, will you be able to do this job? And I said yes, without stuttering. So he gave me the job. So it's people like you who have the courage to stand and work and uh, at the workplace, and by being proud that who we are. And along with that, we also need the system, the people who, who could not only uh, 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 create inclusivity, but also support us. Thank you. So now my next question to you, uh, Aruba. What emotional and psychological challenges do adults who stammer commonly face in therapy? Please unmute.
Yes, I'm unmuting myself. So, adults who stammer or stutter often face a complex of mix of emotional and psychological challenges. Okay, and in therapy, whether it's speech therapy, counseling, or integrated approaches, these challenges can deeply influence engagement, progress, and the person's self-perception, such as many adults who stammer experience heightened anxiety in situations involving verbal communication. For example, especially introductions, when you have to say your name, my name is this, and phone calls, public speaking, and then we have shame and embarrassment, which is way more prevalent with this type of We can say stuttering. Many have internalized negative societal attitudes that equate fluency with competence or intelligence. They feel like if they can't speak properly, they are less than the other person. Am I getting- Uh, we have shame, embarrassment, and low self-esteem and self-efficacy, and there is lots of avoidance and withdrawal. Not in the case of Douglas, but still we have many people who who have social avoidance. Uh, the main thing is identity and self-acceptance. This is very difficult for them to accept that they stutter. Depression and hopelessness. It's quite common in stuttering. Overall, I can say that, let me see, adults who stammer often face anxiety, fear of judgment, and shame about speaking. Many struggle with low confidence, self criticism, and avoid situations where they might stammer. In therapy, they are not just working on speech, but also on accepting themselves, managing fear, and rebuilding their confidence in how they communicate. Thank you.
Thank you, Aruba. Like, I can totally relate to, to that because of my own mental health issues. So when I graduated, I make a list like these jobs I will never do. Like teaching, sales, marketing. You have to talk on the phone. You have to go and talk to people, and so much more. I have never dreamt in my wildest dream then one day I will be on the ISA uh, podcast, and I will be moderating it. So, like, when we face our fears, the growth starts there. Thank you. Now, moving.
Could I add a little bit to that, Ahmad, if you
Sure,
don't
sure,
mind?
sure. Sure, sure,
Um,
please.
Ruba is spot on with everything she said. And even with me, there was always this a struggle when I was in a social environment. I would go to the area, the place. I would be there, but I would sort of stay in the background, where my natural uh, personality is to be up front. But because of the stutter, I would go there, so I would socialize, but I would stay towards the back. And there are many other things where stuttering, um, I would say it kept the true Doug inside. There were certain things I would still not do, and I don't even do those things today, even though I am way further along now than I was then. I do not tell jokes. Okay. Even though I can do a speech and a presentation, I do not tell jokes. The other thing I don't do is, how when you have a dinner at the house or something for a particular holiday, and the man of the house is supposed to say the blessing or the some sort of religious type thing, for dinner, right? And it's usually the man of the house. I almost always defer that to my wife or someone else to say, because I never really learned how to say a blessing. Okay. There's a certain sort of words you use and certain things you do. And I never really learned how to do that. And it was mainly because of my stutter. Those are the things that I avoided because it put me on the spot, and I was not able to deal with that in those days, But now I am able to deal with it better. But anyway, I just wanted to add that.
Thank you, Doug. I have been there. Like when I was around 30, I said to myself like it's going to be like a decade that I'm being frightened of stammering. The gun of fear is to my head all the time. I can't live like that. With this fear, it's impossible for me to live the next decade or the next 2 decades. I can't do that. So from there, the change started. I started to confront my own fears, and from there, uh, the things started to change. Yeah. Um, Moving forward to yes, we have Dina uh, with us. Welcome, Dina.
Thank you. Glad to
You
be
are
here.
you are right on time. So my question to you uh, is before wasting a single second, how closely are stuttering and anxiety connected, especially in therapy?
Okay, well, let's just take a step back. In terms of developmental stuttering, there are different types of stuttering, but in terms of developmental stuttering, where a person, every child goes through a period of normal disfluency, and some children don't outgrow it, usually over the age of 5 years old. And when a child first stutters with developmental stuttering, it is just a behavior. But over time, they may develop anxiety and stress and anxiety. So over time, that develops and that becomes.
Yeah,
So
and
initially, when a child first stutters, it is just a behavior. But over time, there becomes an anxiety. And then what happens is sometimes in an adult, the anxiety and the stuttering becomes so interlinked that one can't separate between the anxiety and the stuttering because they're so interlinked. But initially, when a young child, first starts stuttering, there's usually no anxiety linked to it because the child is so young. So until the child um, realizes that they are stuttering or people may negatively react to it, it is just a behavior. Does that make sense?
Yes.
yes, Dina, it is. I can relate to that. Like when I was young, I have no memory of stammering. Yet I stammer since the uh, age of 2. But I remember, I think I was 5 or 6 years old when someone pointed out that how you are speaking. This is
Yeah.
not the right way to speak. And when I still remember that moment, before that I have no memory of stammering, but from that point I remember the way I speak, this is not the right way. And from that I was conscious, and with each negative experience there was a negative mark on my subconscious, and due to which when I entered into such you can say situations, I started to have the anxiety, the stress, the fear, and with each negative experience, that started becoming more bigger and bigger.
Absolutely. So to go back, so initially with a developmental person who stutters as a child, there's no anxiety, but as or very little anxiety usually. But as one develops, the anxiety feeds into the stuttering, the stuttering feeds into the anxiety, and then what comes first? It's very difficult to know what comes first, the stuttering or the anxiety. And therefore, in an adult, it's not that the anxiety causes, one can't say the anxiety causes stuttering. One can't say that stuttering causes anxiety. But what one can definitely say is stuttering is exacerbated by anxiety. And as a result, there is, and I know the topic of this is mental health, right? And anxiety, and I know we have, I'm sorry for coming in late, and I'm sorry about that disturbance, and I believe we have a clinical psychologist here as well. Am I correct?
Yes.
Yes, and I'm sure you can relate and help us understand the link between anxiety and maybe excessive anxiety, which may lead to mental health, which issues, which as one sees in people who stutter, does occur sometimes, the depression and the embarrassment, because of all those feelings that are linked to the stuttering, but that is not caused by the stuttering, and the stuttering is not caused by that. There is an equal amount of play, if that makes sense.
Yes, you're right, Dina. This happens.
So I have two more questions for Dina, because I'm thankful to her for being here today, despite of her busy schedule. So I will, because she is here uh, uh, for a short time, so I will ask her the questions, so she may can leave early. Yeah.
Yeah,
So
thank you. Apologies. I got my time zones across the country
yeah,
confused. So that 8 p.m. was
yeah,
your time, not South African time. So I'm just juggling.
that's
So
true.
thank you
That's
for
true.
being so accommodating.
You're welcome, Dina. So my next question to you is: how does being a therapist who stutters shape the way you support clients?
Well, this is a question that it's very, and it's also, the line is very is a very balanced line, where I come in and as a speech therapist, and obviously I've studied and I've got my master's in speech therapy. So I have my clinical skills behind me, which is really important that I bring to the clients. But at the same time, because of my personal experience as a person who stutters, I'm able to identify with some people who stutter, and I'm able to also give them some insight and knowledge which perhaps a person who doesn't stutter doesn't have. So or is has it in a different way from reading rather than experience. So what I do is I read my client and what they need at that specific time, or what they ask me, and then it gives me something that extra that I can give to my clients. And it's quite interesting on the mental health side and the anxiety, because I know this speaks to this part of the podcast, is I went to many speech therapists, a couple of speech therapists as a child, before I found that speech therapist to help me achieve the fluency that you are hearing today. And the difference between those therapists before I got to the therapist to help me and gave me techniques at the age of 16 was she also dealt with me, Dina, as an individual. She probed into some of my emotions, some of my thoughts, some of my feelings, which are very important to probe into, because, and I know over the years, the terminology in the stuttering world via speech therapists has also changed. It's not a stutterer anymore. It's a person who stutters, because a stutterer is all a person is, a person who stutters, right? But a person who stutters is a person who encompasses everything and is a person who stutters. So I'm Dina, I'm a woman, I'm a mother, I'm a daughter, I'm a friend, I'm a speech therapist, and I'm a person who stutters. I'm not just a stutterer. So that speaks to also in terms of how a speech therapist needs to look at, or not needs to, but should look at the client in front of them as holistically, rather than just the stutter. Techniques are really important. Techniques are really important, but at the same time, it's important to also listen, and I'm sure psychology plays a lot into this. And Doug and Olga and Ahmed, all of you know as a as a person who stutters, there is so much going on, not only with your speech, but your emotions and your thoughts. And stuttering is compared to an iceberg. And Ahmed, if I'm talking too much, just jump in here. And I think I'm just, you know, I'm just also talking about other questions that you've asked me. Is stuttering is compared to an iceberg. The tip of the iceberg is the overt stutter. The overt stutter is what a person hears, the listener hears. That may be the repetitions or the blocks or the prolongations, okay? But that's just the tip of the iceberg. There is so much going on underneath the iceberg that one doesn't see. And that is the covert, what we refer to a covert stutter. That's your emotions, that's your thoughts, that's your feelings. And sometimes, you know, speech therapists do some CBT stuff as well, which is cognitive behavioral thinking, which is also important because, yes, one learns techniques, easy onsets, light contacts, prolongations, whatever one is taught in therapy, but then it's about the implementation and it's about the confidence and it's the esteem. And, you know, it's very difficult to forget one's childhood, one's past experience when being teased, you know, what one's parents or teachers or friends may have said. So it's really important holistically to deal, to manage, to talk to a person who stutters.
That's so true, Dina, because when we speak, this is not just the words, this is the mind. And in the mind, they are not just words, they are feelings, they are the emotions, that how we are feeling, where we are present, whom we are talking to, what are our past uh, experience with that environment, with that situation, with those people, and so on. So being a stammerer, we have the anxiety, we have the low self-esteem, we have the stress. So and we also have the guilt. So all those things are there. With that, we are not able to speak in front of people in a good way. So that, link to my next question to you. Um, Are therapy models today integrating mental wellness enough? What would you improve?
So it's a very good question, a very broad question, because there are many different speech therapists out there, and there's no one protocol, and there's no one textbook, and there's no one way of dealing with stuttering, because, as we all know, there is no known cure for stuttering. So each therapist, every therapist that one goes to may have a different approach for therapy. There's two main types of therapy. There's a fluency shaping and a stuttering modification approach. One kind of approach, a fluency shaping approach, generally targets just the overt stutter, just the overt behavior, which is a stutter. So the client comes in here, I teach them techniques, I say, lovely, go out there and use them. Goodbye. Okay. The stuttering modification is more of a modifying the actual stutter. So it's not a fluency shaping. It's not giving them people who stutter a replacement speech, but it's teaching a person who stutters how to, sometimes we call it stutter more easily. Okay. And then at the same time, what that approach does, it deals with the person who stutters. They're going back to what I was saying earlier, talking to that person. Dina, how does it feel when you stutter? What are you thinking? It's exploring those other issues. It's the cognitive, it's the emotional issues behind it. So it's really dependent on the therapist that one goes to. However, generally, I say this generally, and because it's not based on research, but I believe that the therapy world is including more mental health, more anxiety, more cognitive stuff, cognitive behavioral, more emotions, but it's dependent on the therapist and the approach that specific therapist is taking with the individual.
I completely agree with you. Like each stammerer is different from the other, so their speech issues, their mental health issues, they vary from person to person. So for the therapist, like that also changes depending on their severity of stuttering, and with that the depth of their mental health issues. So you can't make one you can say tool or, fits uh, all. Yeah.
Yeah,
Thank
absolutely.
you.
And just to add something that really spoke to me, that my therapist used, my speech therapist, when I went to speech therapy all those years, ways ago, when I was 16. I'm not giving away my age now, and I still use in therapy myself. And it is a psychological paradigm called Cooper's ABC. And if you imagine a triangle, you have A, which is affect, B, which is behavior, and C, which is a cognition. This can apply to anything. We obviously going to apply it, and I'm going to apply it to stuttering. But your behavior, what in this discussion is one stutter. The cognition is the thought processes. Your affect is your emotion. So what generally happens with a person who stutters? I stutter on my name, and I'm going to make it personal, right? So I stutter on my name. What's going to happen? I'm going to start thinking negatively. What is he going to be thinking? He may think, I don't know my name, I'm stupid. Feeling is going to be negative. I'm going to feel embarrassed. I'm going to feel anxious. What's that then going to do? It's going to be a vicious circle. I'm then going to stutter more. My negative thoughts are going to get even more. My negative emotions are going to get even more. So one of the things from my experience personally, and also what I do therapeutically, is it's important to target the behavior, which is a stutter, by giving the individual techniques. It's important to target the cognition, which is the negative thought processes, okay, which is important to look at what negative thought process he or she is having. And obviously, what's really important, and I'm going to just sidetrack for 1 minute, is we are speech therapists. And if there are issues beyond speech therapy, it is important to refer to a psychologist, because we are not trained to deal with things beyond speech. So, and I think most speech therapists know this, but if it's got to do with speech, okay, and there are specialized programs that speech therapists do. So one deals with the cognition in therapy. So looking at that, is it true that someone thinks you're weird? What can you do with that thought? And then looking at the emotions. And in therapy, targeting the techniques, giving a person who stutters technique, the emotions, by looking at the different emotions and the cognitions. I believe all of that is really important to deal with the person who stutters holistically, and that will all impact on a more positive mental health and mental state of an individual who stutters, rather than all the negative that's going on, which is understandable.
Thank you, Dina. You are right. To treat with the psychological issues, we need to uh, understand them, and when we are able to do that, then we are able to treat them in a um, uh, better way. And as you said, you won't share your uh, current age. So if you ask me, you are still 16.
Oh, well, thank you. Thank you so much. I believe I'm a
Well,
bit older than that, but thank you so much.
so like uh, before you go, what message would you like to share this International Stuttering Awareness Day with um, uh, anyone silently struggling with stuttering?
That there is always hope, it is never too late, and there's always light at the end of the tunnel, however dark it may seem. And it's just about taking that small step and finding that someone who can hear you and hold you and lead you to someone who can help you. So, no, don't give up. Never give up. And there's someone out there who can resonate, identify, and help you take you forward.
Thank you, Dina. Thank you so much. This is the hope that passes through this difficult time of stuttering. We all been to that place, that difficult dark time when we thought, oh, I'm not able to survive in this world. How will I progress? But we all did due to hope. Thank you.
Yes, absolutely. And stuttering is just one part of an individual. And as everyone says, and as Joe Biden said, do not let it define you, right? As everyone,
Right.
it's one part of you. You're not a stutterer, you're a person who stutters, and a person, lots of other things.
It is. Thank you.
Okay. Apologies for arriving late and apologies
No,
for the disturbance and leaving early. But thank you for this opportunity, and
okay.
we'll see you all soon.
See you soon. Yeah.
Thank you.
Yeah. Take care.
Okay. Bye.
Bye. So, Doug, my question to you is, uh, how do peer support groups help improve mental well-being for people who stammer?
Well, for me, it was absolutely critical. One of the things I need to note is that when I was hearing Dina speak, who did an excellent job of really going into the various issues of those who stutter, and especially about calling someone a stutterer as opposed to a person that stutters, is that you have to find a program, a therapy program, a technique, or something that deals with the whole person. And that is very, very difficult to find a well-trained speech language pathologist that is also well-versed in the other aspects, the emotional and the mental part of stuttering, which is actually the more significant part of stuttering. It's hard to find those skills in one person. And for me, I wasn't able to find that. So actually, I come from the world of the fluency shaping program. And as a part of the NSA, which is a self-help support group for people who stutter, they do not espouse or promote any particular type of speech therapy technique or speech therapy at all. But they do provide something that is extremely vital and important for those of us who stutter that are on our stuttering journey. They give you they empower you with information and knowledge that will enable you to not feel ashamed of your stuttering. They give you the information and the support in many different ways so that you can recognize that stuttering is not the worst thing in the world. A lot of us who stutter believe it is, because for the most part in our early lives, stuttering is the worst thing. It is preventing us from living our true lives, being our best selves. And the NSA as a peer group, it provides that family, that stuttering family, which we now call a STAMMA, and gives you the strength. It gives you the knowledge of truly knowing that you are not alone. You are not the only person in the world that stutters. You're not the only person that has to deal with life as a person stuttering, with that struggle, with the embarrassment, the shame, the inability to convey to others who you are, which gets at the heart and soul of every human being, because being verbal, speaking is such a vital part of who we are as people. And as being a part of the NSA, that's where I got the emotional and mental strength to be able to undergo more technical speech therapy and techniques. Those two things together, the support group of the NSA plus the speech therapy technique, precision fluency, that I actually got from a person who also stutters and practices the technique. Now, he made it very clear, I am not here to deal with the mental and emotional side of stuttering. It's there, I know it's there, but that's not what I do. What I'm here to do is to teach you fluency shaping techniques that you may be able to use in order to communicate in a way that you want to communicate. The two things together is what I've used in my stuttering journey. Without both of those, I would not be able to present the person that I truly am, which I am able to do today. Again, the other part of what Dina was really focusing on, I think, which is important for people who stutter to really get, is that you have to deal with what other emotional and mental issues that may be having an effect or may be preventing you from being able to communicate in a way that you would like to communicate. It doesn't mean you have to be fluent. It just means that you have to be comfortable with yourself enough to say what you want to say. It's that simple. And whether you stuttered or not, if you're able to just communicate in a way that you are comfortable with, then that is the goal. And if there's anxiety in issues, if there are some other things about self-awareness, self-esteem, if there's some other trauma in your life or something like that that may affect how you present yourself verbally, then those things need to be addressed, because without handling those, I'm not sure you're able to progress in a way that you would like to progress when it comes to stuttering.
Yes, Doug, it is, as you said, like we are not alone. So if you are not in the peer group or in the support group, sorry, we feel that we are alone in the world, and we are, surrounded by people who are non stutterers. They can speak uh, 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 fluently, and we uh, envy them. And being in the support group, that's change everything. In Pakistan, we didn't have the support groups. So in say Global and Pakistan Stammering Foundation, we started the support groups, and especially for me, that has changed a lot. When I was with the people um, like me, so I was able to see the issues I have. They also uh, have that, and I was able to experience that, how they deal with that. And that gave me a kind of peace, that I am no longer alone. There are people in the world who are facing the same issues, and they're coming out of their comfort zone and they're doing so much more. So we learn from each uh, other.
Yep.
Thank you. So my next question is to you, Olga. What challenges do young people who stammer share with you, and how we can support them better?
So, speaking to other young people or young adults who stammer, one of the issues that do come up is the world of work, as that can be quite a pivotal time for someone as they approach adulthood and having to navigate their stammer in the workplace and through and throughout the recruitment process. So that's through interviews and even when applying for new jobs and and having that debate with themselves of whether or not they should declare their stammer on their application form or throughout the recruitment process. And another issue that does come up is support once you turn 18, especially for stammering. There is definitely more help out there as for children who stammer, but then once that child then becomes a teen and then becomes an adult, the support out there tends to decrease, and we find that it's not as socially acceptable to stammer once you become an adult. So again, navigating the healthcare system as a person who stammers and stutters in each country has their own ways of working, but those two themes seem to be universal with the young adults I've spoken to from different countries.
Yeah, like especially at the workplace, um, and uh, in the recruitment process. We being stammers, we don't disclose that we stammer, and that really uh, put strain on us. So like if we are able to do that, or there are people in the company or in the e- um, uh, HR, if they could help the people who stammer to go through this process more smoothly, and help them to disclose their stuttering. I hope that will really help. My next question to you, Aruba: how can psychotherapy and counseling complement speech therapy in managing anxiety or fear of speaking?
So, psychotherapy and counseling can make a huge difference alongside speech therapy for people who stutter. Speech therapy is great for learning techniques to manage speech, but it doesn't always deals with the emotions behind it. Like Miss Dina has mentioned already, the anxiety, fear, or self-doubt that often come with stammering. That's where psychotherapy steps in. Through approaches like cognitive behavior therapy, like Miss Dina has already said, or mindfulness techniques, people can learn to manage the fear of speaking, challenge negative thoughts like everyone is judging me, and break the cycle of anxiety. What is the vicious cycle of stammering? Stuttering, anxiety about stuttering, more stuttering incidents, more anxiety about stuttering. So, this is the vicious cycle which they have to break. So, uh, so the cycle of anxiety can make stammering more worse. Counseling also helps explore the emotional impact of stammering, feelings of shame, frustration, isolation, and replace those with greater self acceptance and confidence. Think of it like this way: speech therapy helps with how you speak, while counseling helps with how you feel about speaking. A lot of people who stammer get anxious, worried about being judged, or frustrated when words don't come out right. Therapy can teach ways to handle that fear, challenge negative thoughts, and build confidence. Basically, it makes speaking less stressful and help you feel more comfortable communicating. So you are not just focusing on your words, but also on staying calm and confident while you use them. I hope that clears.
Yeah, you talked about the vicious cycle. So I, remembered mine. Like being in the interviews or in the presentations, I try to speak. I was not able to speak. I try to push. My name is, and I was, trying to force so much, and in the end, I was feeling, bad and guilty that I was not able to perform well. I have so much to share, so much to talk about, but I was not able to uh, deliver, and I can't speak. So with that experience, the anxiety and stress, that gets more, and I feel more guilty and more anxious and so on. So this is uh, exactly a vicious cycle, and I broke that when I started counting my fear. So like when I stepped into a situation, and I immediately felt the fear. So I said, "Oh, hey, fear, wait a minute." So I thought to myself again, okay, I have taken the treatment. I have started joining, say, Global Toastmaster Club. I'm going there. I'm making their speeches. So why I'm feeling that fear? Because that fear is deep down into my subconscious. And psychology of a human is very complex, very deep. Sometimes we think we have treated, but we don't know, because that can surface at uh, any time due to any incident and so on. So when I started to countering my fears, I wait, why you are coming now? I can you know uh, uh, handle this situation. When I started replacing the bad experiences with the positive ones, that was the time when I broke that vicious cycle. Thank you. So my next question to you, Doug, is advice for those struggling with isolation or shame due to stuttering.
Um, my advice is sort of twofold. Number one, find some sort of self-help stuttering organization to be a part of. I think that is vital to your journey. Be a part of some group. And there are so many more groups today than there were when I was a kid, all over the world. And you can reach those groups much easier through the internet, thank goodness. The other thing is that I would advise people to sort of engage in what I've termed a self-analysis. That's what I've done over these many years. I'm the oldest person here. I am 65. And my journey has been a long journey of learning a lot of different things. And one of the things that I've come to learn is do that self-analysis, because we're not all the same. While we stutter is not all the same. So an individual has to, in my opinion, do a self-analysis, whether they are an anxious person. What are they anxious about? Is it speaking in general? Do they feel comfortable? All of these various things. And when you go into a speaking environment, what happens to you? Do your hands start to sweat? Do you feel nervous? Is your stomach up? Or what are you nervous about? What are you? All of these things. I know that it sounds like a lot, and it is a lot. But that's what I've done over the years. I went into a self-analysis to understand, because I knew it wasn't because I was shy. I knew it wasn't because I was anxious about speaking. I knew it wasn't because I like having eyes on me. I enjoy that, actually. I like that. I've always known that. It was simply when I opened my mouth, I wasn't sure anything was going to come out. So that is where the fear was. Okay. So for me, it was all about, as Ruber had said earlier, is finding out what mental, emotional stuff that was playing a part in affecting my ability to speak. So I went to a speech therapy program that's focused on techniques because I needed to know, I myself, when I walked in the room, I needed to know what I needed to focus on. Okay, when I got a little bit anxious, what can I do to reduce that anxiety? Because I knew that if I wasn't afraid to speak, if I knew that the words would come out, the content would be there. I would be able to say what I wanted to say. And so that's what I focused on. And I realized real quick what was going on. Because I was cutting the air off, because when I opened my mouth, it was a hard block. The cords were spasming. I knew that I needed to work on breathing. I knew that I needed to make sure that I had a constant airflow. I knew I needed to slow down my rate of speech, even though I'm from the South and everybody thinks we talk real slow. I was a fast talker. So the rate of speed that I use now is nothing like I used to use when I was a kid. So these are the things I would advise people to really, really, with the help of a therapist, because I believe in therapy, with the help of a therapy and a holistic approach to speech therapy, do a self-analysis of what exactly is going on when you are stuttering, whether it's in a party environment, whether it's at your church, at school, at work, whether you have to do a presentation, whether it's spontaneous speaking. Really figure out what is going on with you, and then figure out what best is out there, mindfulness, some sort of speech therapy program, a CBT, whatever is out there. Yoga may be something that could help you as well. Whatever is out there that is legal to help you feel better emotionally and mentally, that may impact your speech in a positive way. And join a support group. I joined a support group 40 years ago. That support group has been a large part of my life. It has enabled me to progress along my stuttering journey. And more than that, it has allowed me to meet a lot of wonderful people.
That was spot on, Doug. When you shared that you have the fear that the words won't come out of your mouth, I had the same thing with me. Going somewhere, talk to people, I was not worried about what to say, but how to say. I knew I will try to speak and the words won't come out. So when I joined the affluency craft, that really helped me. The speech management, gave me the tools, the weapons, so I could use them to speak in front of people, and especially the part of the psycho therapy that helped me to not only understand myself, because before I thought that I don't have any psychological issues. But when I went through the sessions of psychotherapy in affluency craft, I was able to understand myself, and I was like, wow, I have that deep mental health issues that I never knew about. So when I was able to understand myself, and I was able to deal with my psychological issues of like the speech therapy dealt with that, and the psychotherapy dealt with the mind. So when I was in control of both the places, so then I was started to feel confident. Now I can able to speak anywhere. So if the words won't come out, I know how to make that um, happen. And when I'm feeling anxious, stress, I'm anxiety, I'm feeling the fear, so how to deal with that. So when those two things combined, that was magical. Yeah.
Yeah. There's one other thing I need to add that hasn't been mentioned yet in this podcast, which is actually actually critical in the stuttering community, and I believe is critical for the person that stutters, is the word acceptance. Acceptance is huge, I believe. Acceptance is what enabled me to do everything else. For years and years and years, I denied the fact that was obvious, that I'm a person that stutters. I was trying to be a fluent person. We who stutter, we who truly stutter, you're not a fluent person, and that's okay. When you accept the fact that you do stutter, okay, I believe that will allow you to be freer, to be braver, and to be able to grasp and learn all of the other things that you need to learn, because you will stutter. And when you stutter, if you accept that and know that, it's not going to destroy you. And that's what I had to do. I had to really accept the fact that I'm a person that stutters. I'm not a fluent person, because that's what I was trying to be, was a fluent person.
Doug, that's so true. The last year, I have worked on my acceptance because I felt that when during talking I stammer, I felt the shame and the guilt. So I talk to myself that I say to people that my superpowers are acceptance and disclosure. So when you go to the website of say global, it's uh, written there. My superpowers are acceptance and uh, a closure. So I talk to myself that I'm uh, telling all the world that acceptance is the key, and I have applied to myself, but still I feel the shame and the guilt when I stammer. So I started to work on that. So whenever during a conversation I stutter and I got that shame and guilt, I talk to myself, this is me, this is the way I speak. I don't need to feel the shame and the guilt. This is part of myself. So why I need to be ashamed? Like, I don't have here I'm bald and I'm not ashamed of that. So why I'm ashamed of my stuttering? This is me, this is part of my self. At at that moment, I talk to myself again, again, and again, and it really uh, helped. Now, like during the this uh, podcast, I stammer, but still, like, I'm fine because I know I am an individual who stammer. I'm okay with that. I'm happy with that. Yeah,
Yes.
thanks. So, my next question to you, Olga. What role does representation and community play in emotional resilience of people who stammer?
So when I think about emotional resilience, I think about the ability to adapt to stress and to maintain your overall well-being. And both representation and community play a big role, especially in my journey with emotional resilience. So I would think about representation of seeing other, well, for me, it started by seeing other young adults who stammer, or just other adults who stammer, in my journey into the way of work. So because of my stammer, I didn't think that I was going going to be successful in my career until I came and until I came across other people who stammer who already are working. So there's a charity in the UK called Action Stammering for Children, and they have a page on Stambassadors where people who stammer talk about their own career journey, and that representation what was a turning point in the way I saw myself in my career. I found that sometimes looking at a celebrity figure was too unrealistic to myself. But when I came across ambassadors, I was like, oh, there is a project manager who also stammers. There's someone else who works for the National Health Service who also stammers, which is which is what led me to put more work into my career and into myself, knowing that there's other people who stammer and work at the same time, which then leads to community. So I recently came back from the Erasmus Plus Stuttering Youth Exchange, and that was the first sort of community that, but that I was a part of and was able to maintain. And then I recently also joined Stammily after that. So having that community was so important to me, because it is nice seeing representation where you go on the screen, but I felt like I was still alone, not just in the workplace, but in my day-to-day life, where I was in the world, where people didn't understand what stammering was like, the challenges that come with it, and also the gifts that it does bring. And to me, it did bring a gift of community, and having that community as as well as representation made it easier for me to bounce back when things would go wrong, when people would say negative things about my stammer. Yes, it was hard, but I had a community behind me. I knew that it was possible to step into the world of work as a person who stammers, and that in turn had a positive impact on my mental health.
Thank you, Olga. You are right. The representation, seeing the people who stammer, how well they are doing, and how the community uh, helps us. Like, there are two kind of people who stutter. One, who are better than us, they are more fluent, they are doing great things. And second, who are having more speech problems than us. So when we are having a bad day, we can uh, um, uh, uh, look at them, like, I'm having a bad day, I'm stammering so much, but they are also there. So they are a kind of hope for me. If they are surviving, I can. And when I'm trying to achieve something, and I I look up to those stammerers who are doing those so great, and they are they are prospering in their lives. So at that time, those people give me a motivation. Hey, if he can or she can do that, I can do that. So as a community, we are mirror to each uh, other, to support each other in moving ahead. Thank you. um, my last question is to you, Aruba. uh, what can families, educators, and employers do to create emotionally supportive spaces for people who stutter?
So, families, educators, and employees play a huge role in creating safe, supportive spaces for people who stutter. It starts with listening patiently, letting the person finish what they want to say without jumping in or finishing sentences for them. That simple act of patience shows respect and helps them feel heard. It's also important to focus on what's being said now. Now, how it's being said. When people know they won't be judged for stammering, they relax and communicate more freely. Avoid giving unhelpful advice like slow down or just breathe. It usually adds more pressure rather than helping. Instead, show understanding, keep eye contact, and treat stammering as just one part of how someone talks. In schools and workplaces, however, make sure people who stutter have equal chances to participate in class discussions, meetings, or presentations. That's how they can help. Give them time to speak without rushing and creating an environment where everyone listens respectfully. Educating peers and colleagues about stuttering can also break down stigma and make communication feel more natural for everyone. Most of all, show acceptance and encouragement. That's the main crux of all this discussion. Celebrate their ideas, not their fluency. When families, teachers, and employers offer that kind of emotional safety, people who stutter often gain the confidence to express themselves openly and comfortably without fear of judgment. Thank you.
Thank you, uh, uh, Aruba. You rightly said, let them speak. So this is the main thing. Like
I know
when we
it was.
stammer, yeah. So uh, uh, when we stammer, so people try to complete the sentences, or
I've
this
seen.
their
That's why I know a lot.
yeah,
I've seen it a lot. Breathe. Don't rush in. It's okay. Don't say that.
yeah. Just let them speak. This is the way. Just be uh, uh, patient. This is for all the listeners. Just be patient with the people who stutter. Let them breathe. Let them take the time, how much they need to speak. Like, when I was in university, especially in the oral vivas and in presentations, I talk to my teachers and professors that I need more time because I have a speech impediment. So I fought for my right to get more time, to get the gun of fear, the uh, gun of ticking time down. So there are times when we have to fight for uh, our rights, even when the society is not uh, giving us what we truly deserve. With that, um, my last question to you all: what message would you like to share this in International Stuttering Awareness Day uh, with anyone silently struggling with stuttering? I think we can start with Doug.
Real simple. Google, find a stuttering organization to be a part of. You're not alone. It's an old saying that has been around for a long time, but as a person that stutters, you're not alone. Find an organization to be a part of, and you will begin to find out ways to live your best life. Um, your voice matters. It really does. Thank you.
Uh, Thank you, Doug. Yes, next, Olga.
I would say that, again, following Doug, that there are communities out there that but that but that can help and support you. And if there isn't a community in your local area, feel free to start one, because there will be someone else who would need the community just as much as you do.
Thank you. Yes, Aruba.
So I would say stuttering is not a flaw. It's a unique part of your story, a rhythm of resilience, and a reminder that every voice matters. Keep speaking, keep sharing, and know that your words, no matter how they come, are powerful and are heard.
Thank you. Just a minute. So, yeah. Thank you. Oh, no. Yeah. Thank you. That brings us to the end of this heartfelt discussion. Thank you to all of our panel panelists, Doug, Dina, Olga, and Aruba, uh, for your candor, your stories, and the emotional depth you brought to this conversation. It's clear that stuttering and mental health are deeply connected, and that healing involves both therapy and acceptance, support and self awareness. We all need safe spaces to speak, to be heard, and to grow. As we approach International Stuttering Awareness Day, let's carry forward this message. Every voice matters, and every stuttering journey is valid. Whether you are a person who stutters, a therapist, a family member, or an ally, you are part of this community. Please stay connected with the International Stuttering Association and join us in spreading awareness, compassion, and strength. Until next time, take care of yourself and each other. Thank you.